Hey ho, let's go. My name is MarkAlain Dery, and I'm the Medical Director of Infectious Diseases and Chief Innovation Officer for Access Health Louisiana. I live in New Orleans, where I am right now, and I serve as co-chair for the ACOI Infectious Diseases Subspecialty Section. As providers, we have drastically seen how the realm of public health has influenced our professional lives, whether we serve in academia, in administration, in research, in private practice, or within the hospital setting, or all the above. COVID has become synonymous with the term public health recently, and it has dominated our dialogue over the last year and a half, and rightly so. But we all know that there are other issues that deserve attention too. Now, you know the ACOI for providing a variety of quality CME for physicians, both online and in person. And more than providing internal medicine CME, the ACOI has been working diligently to keep you up to date by sharing updates on the ongoing COVID-19 saga, as well as expanding our coverage to other public health concerns as well. So let's go ahead and get started, and let's talk about intimate partner violence and HIV. As many of you know, HIV is my specialty, and I see several hundred patients a year in just my small FQHC practice that I do once or twice a week. So naturally, when a national study was recently released about intimate partner violence and individuals living with HIV, I seriously took notice. And what I read was disheartening. But as osteopathic internists, our job is to understand our patients thoroughly. And for those of us who treat people living with HIV, threats to their safety are certainly part of that. So the study I'm referring to here specifically from the CDC assessed medical record data as well as results from interviews conducted with people living with HIV from 2015 to 2017. And the survey, which included about 12,000 people, strives to produce nationally representative estimates of socio-demographic, behavioral, and clinical characteristics of people living with HIV in the United States. And to sum up the results, about 26% reported having experienced physical intimate partner violence in their lifetime. And looking at what groups experienced the most violence, here's what was revealed. Whoops, hang on a second. Let me, my bad. That is always horrible to do in the middle of a video. All right. So, again, looking at what groups experienced the most violence, here's what was revealed. White and multiracial people reported more lifetime violence, that's 31%, than Black and Hispanic people, that's 23% and 24% respectively. Now, the 25 to 34-year-old age group had the highest rates of lifetime violence at 31%, followed by 35 to 44 years old, and that were 30%. So, interestingly, responses differed by sexual orientation. A whopping 52% of bisexual women reported a history of violence, the most of any group. Now compare that with 35% of heterosexual women, 28% of gay men, and 25% of bisexual men, 22% of lesbian women, and 14% of heterosexual men, who all experienced intimate partner violence. And frankly, all those numbers are too high in my estimation. Now, another interesting revelation was that those reporting homelessness in the last 12 months were more likely to report a lifetime history of violence than those who weren't. Now, it's important to note that the study only looked at physical violence, not sexual or emotional violence. So the true impact of intimate partner violence among people living with HIV isn't fully captured in the study. And as healthcare providers, we have to screen for intimate partner violence during initial HIV testing. Certainly this guy needs to, and as well as during emergency department visits, and certainly during routine medical care. And if we find patients reporting intimate partner violence, they should be offered supportive services, and of course, for marginalized group like the LGBTQ plus people and racial and ethnic minorities, programs to prevent violence prevention should be tailored for their needs. Now, considering HIV health outcomes, those reporting physical intimate partner violence had worse care retention and were less likely to be on HIV antiretroviral therapy, had more no-show medical appointments, had more emergency room visits and admissions, and not only that, but they also had less viral suppression, increasing the likelihood of being able to transmit HIV. Intimate partner violence leads to worse HIV outcomes. Hence, we need to be more diligent with screening. As physicians, we need to be familiar with resources in our area to recommend to our patients in order to prevent such violence and help them pursue healthy relationships. Now, the U.S. Department of Veterans Affairs offers an intimate partner violence assistance program, since it turns out that veterans are twice as likely to experience intimate partner violence in relationships. Also, I'll make mention of the national hotline to be aware of to pass on to your patients, and that number is 800-799-SAFE. That's 800-799-SAFE, 800-799-7233. More information can be found in the links associated with this video blog. All right, let's shift a little bit and talk about trans medicine expertise, something that's incredibly important. Certainly something I did not get word one from in medical school, but certainly we're starting to see a lot more conversations about this, so it's so important for us to talk about it. Back in 2015, in a survey of people of trans experience, it was discovered that there was an urgent need to prioritize transgender health policy in the U.S. And recommendations from this study include developing more med school faculty expertise in trans medicine, professional organization, requiring trans content on licensure exams, and state licensure boards requiring the continuing education in trans health. Now, it turns out that the fields of medicine and interprofessional education have created the majority of interventions as students increase their knowledge, and they are developing a higher comfort and greater confidence in working with people of trans experience. But the gap was discovered in trans care education in schools of counseling, social work, and public health. Wow, okay. Simply put, they are just not adequately developing curriculum and interventions that prepare students to work with people of trans experience. In a report that just came out this week from the Center for American Progress, it was revealed that people of trans experience fear discrimination, and that fear leads them to not seek out medical care. The reason for the fear is that the experience of people of trans experience is that nearly 70% of transgender people of color report mistreatment by medical professionals. So why would they even report and reach out anyway? Consequently, many who do end up seeking health care have waited too long. They end up in the ER with conditions that wouldn't have been considered an emergency had they taken care of it sooner. Additionally, people of trans experience were more likely than cisgender adults to be told that they have depressive disorders. They also have increased likelihood of having asthma and developing cardiovascular disease. And to make matters worse, the COVID-19 pandemic has also aggravated the situation. One in three people of trans experience report having had suicidal ideations during the pandemic, and 1 in 2 reported that their access to gender-affirming healthcare was curtailed significantly by the pandemic. So, how do we get better at treating people of trans experience? Certainly, it falls on us as medical professionals to educate ourselves more. For me, I'm looking forward to hearing my colleague, Dr. Mia Taormino, host a lecture on LGBTQ health this fall at the 2021 ACOI Annual Convention and Scientific Sessions. Yay, super excited for that. The good news is, by placing more emphasis on trans health for students and for those of us who have been practicing for decades. Whoa, let me read that sentence again. For those of us who've been practicing for decades, there's an S on the end of that word. Yes, it's been decades. We will be working together, erasing discrimination and care that for far too long has hurt our patients and those who identify as being transgendered, those of trans experience. So stay on the lookout for these updates, and to read more from the resources used in this report, go to acoi.org/resources together with the ACOI. Hello, ACOI. Thank you for letting me do these videos. We will help you have the latest to help you respond to your patients. And also, please feel free to reach out to me. I love hearing from you at madery@mac.com. Please stay safe. And as always, thank you, Gina Kelker, for such a brilliant script.